I think for me what was most impactful, just in general, was really helping me realize what I wanted to focus on as far as like my future career goals. I definitely was interested in mental health, but having the experience of following a psychiatrist at the autism clinic really solidified for me that I want to work with this population. I wouldn't have felt comfortable, I think, if I hadn't had this fellowship and gotten some of those anxieties out of how to speak to patients with disabilities.
I noticed we worked with a lot of patients with profound disabilities, some of whom couldn't speak, and that really prepared me for going into the clinical setting in our last semester, because a lot of stroke patients are initially averbal or permanently averbal, and I had no problem just talking to them like they were verbal, and it was great, and I could tell that they were more comfortable, I was more comfortable, and before this I would have been shaky and probably a little bit inauthentic just because I was so uncomfortable.
Yeah. I think when David and I were at the amputee clinic and we had to do a blood pressure reading on a patient who had bilateral amputations in the upper extremities, and we were nervous, and we learned that it's okay to ask, and there's no harm in asking. So I think a lot of what this fellowship did for us is learning that it's okay, and it definitely tears down some of the walls, and this fellowship helped do that.
I think you are treating the whole person. Somebody comes in because they had a surgery, like some kind of L4, L5 laminectomy. There's lots of other things going on, and not all of those issues with that patient has been treated properly due to time constraints or maybe other reasons. So you pick the patient and you try your best to treat them holistically, and the disability comes along with that, and I'm willing to do it because it's kind of a challenge, but it's also interesting.
I agree. I feel like this fellowship has given me the opportunity to learn about certain characteristics of disabilities, but not letting that define how you care for the patient, but letting it kind of guide how you care for the patient, and still learning to find the individual in every patient. So learning to combine both of those. So yeah, it's helped me a lot with that.
I think that my interests and my attitude kind of go in line. So because I'm more interested in it and because I have some experience with it, my attitude is so much more positive toward it, whereas before I was a little more neutral.
I think for me, my attitude has definitely changed, but I think from a stand of I feel awkward and therefore I don't want to be around them because I'm scared of making them feel uncomfortable, to now I feel competent and I want to be around them because I feel like I can help them out.
Mm-hmm.
I would say similar to Andrea, in some ways my attitude has stayed very much the same. I was compassionate before this clinical experience, and I'm compassionate afterwards, but my willingness to engage has increased because I'm more familiar and I was exposed to these situations in a kind of training type of atmosphere. So now I feel more competent in going in and working with them and doing whatever needs to be done in the patient room.
You're going to find people with disabilities along wherever you decide to work, and I've actually had that experience, and it allowed me to connect with someone, and that felt so good and so important. I really felt like it helped to give care to.
One of the huge advantages of doing this clinical experience is not just working with the different patient population, but also going to the different facilities. So with a given clinical rotation, you go to one hospital, which is fine, you do 7 or 8 shifts, but with this clinical we had 14 or 15 different days where we went to 14 or 15 different places. And so for somebody starting out their career in healthcare, you can see the kinds of patients and the kinds of facilities that you might want to work in the future. So that was a really positive thing for me.
This really pushes you to get over that fear and develop the confidence and the competency and the skill sets to communicate better and more effectively with all patients, any patient.
My biggest thing was I didn't want to ever be in a position where a patient came into the hospital and I wasn't able to care for them or comfortable caring for them, and I knew that this fellowship would help bridge that gap.
It's just a great opportunity to help you be the best nurse that you can be. So it's just another tool that you can use to help you connect with people, and kind of like how we had a mandated gerontology course, I really think that this should be mandated because, like I said, even if you don't want to work with this population, you can't help but to interact with this population wherever you're at. And it's such a good feeling to know that you can connect with your patients.